one thing? What's one thing you want people to know about your pain research?
The words that we use to describe pains can actually influence how the patients and the public think about the pain conditions and what they need to do to manage it. So in my recent research, we found that when we tested the influence of the 5 diagnostic labels for neck pain after road traffic injuries, we found that for example, when people given the label neck strains, they had higher recovery expectations compared to those given the label whiplash-associated disorders or neck pains. And our qualitative research found that the labels whiplash-associated disorders more frequently evokes negative feelings like psychological distress and make people think that this kind of conditions is more severe and then they need to avoid physical activities. In the contrast, when people given the label neck strains, it more frequently promote the ideas that exercise is part of the treatments and this condition is less severe. So I think so the language that we used to describe pain for patients matters. And so we need to be mindful of the language that we use in our clinical consultations. And it would be good to check with the patients when we give the patient the labels, how they understand the labels and what the label means to them and what kind of feelings they associated with the labels and what kind of treatment expectations that they would think about when they see the labels.
So it's accurate to call it whiplash associated disorder, and it's also accurate to call it a neck strain. And to me, it's that last word, disorder versus strain. Have I got that right? Like, so a strain sounds more treatable than a disorder?
So when we test the difference between these words, we could not say the specific words, but some patients did mention that disorders made them think about, post-traumatic disorder, so that would link to more severe conditions. And interestingly, we also test the label neck pain. So neck pain sounds very simple, but then people will think that this is just something that the clinicians doesn't know what happened to them. So this is just the terms that they use to try to let people know what happened to them. So then people often doesn't believe about this kind of diagnosis because it's too vague. So they often will say that they will need to see another healthcare providers to get more definite diagnostics.
Yeah, wow. It has implications for like health professional training and lots of things here. So thank you so much for sharing your research today. That's great. And we look forward to seeing what comes next.
Thank you.